My name is Stacey McCrory and I'm a registered nurse. I'm a nurse practitioner student at Auburn University, and today I'm going to be performing a head-to-toe physical assessment on Erin. For the purposes of this video, Erin's going to remain in her gym clothes. I have come into the room, I've done hand hygiene, I've made the room comfortable and private for the patient. And during my assessment, I'm only going to be assessing one part of the body, if like the eye or the ear, if there are two parts. So I'm going to start out. I've gotten Erin's vitals, which include her blood pressure, her heart rate, her respirations, her temperature, and her pulse ox. I have obtained her height and her weight so I can calculate her BMI later. So I'm going to go ahead and start out with my general survey. Erin is awake and alert. She's looking at me. She seems to be dressed appropriately for the weather because it's 80 degrees outside. She looks to have good personal hygiene. She's clean, her nails are clean, her hair is well groomed. She doesn't have any odors. So I want to also tell you that throughout the assessment, I will be assessing her skin. Since you're going to be covering the whole body, that's important to incorporate it into your entire assessment. So I'm going to start out by looking at her head, looking at the symmetry, looking at to see if there are any obvious deformities or swelling. Then I'm going to palpate her skull, looking for any infestations, looking at the hair distribution. And then I'm working my way down to palpate the sinuses. So we're going to do the frontal sinuses, which are right below your eyebrow. And I'm going to have you just move over towards the camera, okay? So right below the eyebrows, and then the maxillary sinuses, is that tender when I feel? Okay, so there is no tenderness, which is a normal finding. Now I'm going to palpate the temporomandibular joints. So I'm going to place my hands right here and ask Erin to open and close her mouth. And you just want to feel for any crepitus, any popping or cracking, and on Erin there is none. And now I'm going to assess and palpate the lymph nodes, looking for any enlargement. So we're going to do the preauricular, her postauricular, her occipital, her tonsillary, her submaxillary, submental. And we're going to do her anterior cervical chain, her posterior cervical chain, and then her supraclavicular. And all of those were bilaterally symmetric. There was no enlargement. So now I'm going to look at her eyes. I'm going to look at the eyelashes, the eyebrows, the eyelids, the eyeballs, looking for symmetry, looking at the hair distribution of the eyebrows and the eyelashes. And they are bilaterally symmetric. You want to look at the conjunctiva to make sure they are pink and moist. Look at the sclera to make sure they're white. If they're yellow, that can indicate some jaundice. You also want to palpate the lacrimal gland just to make sure that it is not occluded, and hers is not. So now I'm going to take my ophthalmoscope and I'm going to look inside the eye. So I'm going to make sure there is the red light reflex, which is present. And again, you would be assessing both eyes, but for right now I'm just going to assess one. So I'm going to come in. And so you want to just look at the optic disc, the fundus, the macula, look to see the blood vessels and the arteries, make sure there's no narrowing of the arteries or any hemorrhages. And she does not have any hemorrhages or narrowing of the arteries, so that is a normal finding. So we're going to move to the ears. You want to inspect the outer ear. You want to palpate the auricle, your pinna, and then your tragus, just to check for any tenderness or swelling. There's no drainage to the external canal. And then we're going to use the otoscope to take a look inside the ear to look at the tympanic membrane. You want to check and see if there's any foreign objects, any bulges, any inflammation or redness, any drainage. And Erin does not have any of that. I can see her tympanic membrane very well. It is pearly and gray, and then she does have a good cone of light. So now we're going to move to the nose. You want to make sure that it is bilaterally symmetric. See if there's any obvious deformities, and you can palpate it. to see if there's any tenderness, and there isn't any. Correct. You want to take your otoscope light and look inside the nares, looking at the turbinates. Make sure they are pink and moist with no drainage. And you also want to check the patency of each nair. So I want you to close one nostril and blow out. Good job. So her nares are patent. And now we're moving on to the lips. You want to, in the mouth, you want to look and make sure they're pink and moist to see if there's any lesions on the outside of the lip, any cracking. If she doesn't have any, you want to look inside the mouth. You want to look at the buccal mucosa, the gums, the roof of the mouth, the bottom underneath the tongue. You want to look at the tongue, the back of the throat, and you also want to look at the dentation. So her mouth is pink and moist. She's got good dentation. So now I'm going to check Erin's cranial nerves. And for cranial nerve 1, that is smell. So I want you to close your eyes and occlude one of your nostrils, your nares, and I want you to tell me if you are able to smell this. Okay. So you'd also check the other nair, but that one was patent, and that nerve is intact. So for cranial nerve 2, we're going to do the visual acuity. Normally, I would have patient Erin stand 20 feet from the Snellen chart, and I would test each eye separately and then both eyes together, and I would ask her to read the lowest line that she could read, and then beside the lowest line is what her visual acuity would be. And you also want to check the visual fields and the pupillary light reflex during this cranial nerve. So to test the pupillary light reflex, I'm going to shine this in your eye. And so just look straight for me. When the light is shined, the pupil should constrict and then the other one should dilate. And that is exactly what Erin's pupil do. And we're going to do the visual fields. So can you cover up your right eye? I'm going to cover up mine. And then I want you to tell me when you can see my finger come into your view, okay? So you can also test the other eye, but that cranial nerve is intact. For cranial nerves 3, 4, and 6, you want to test the extraocular movement. So without moving your neck, I want you to follow my finger with your eyes, okay? So that the extraocular movements were intact and her eyes did cross with a combination. So for cranial nerve 5, what you're going to do is you're going to do, it's a motor and sensory nerve. So you want to test the masseter and the temporal muscle. So I want you to clench your teeth, and you should feel that muscle tighten, which hers did, so that's a normal finding. And then to test the sensation, I want you to close your eyes, and I want you to tell me if this is sharp or dull, okay? Okay. And then again, keep your eyes closed. Okay? And then you also want to make sure she can tell you where she's touching. So close your eyes one more time and tell me where I'm touching. Okay, so that cranial nerve is intact. For cranial nerve 7, which is the facial nerve, you want to look at the symmetry, make sure the face is moving symmetrically. So I want you to smile and show teeth, frown, raise your eyebrows, puff out your cheeks, and then I want you to close your eyes really tight and try to not let me open up. Okay, so that cranial nerve is intact. For cranial nerve 8, which is the acoustic nerve, they're going to do 3 tests. So the first test we're going to do is the Weber test, and it tests for lateralization. So I'm going to strike my tuning fork and I'm going to place it on the top of Erin's head, and she's going to tell me if she can hear it in both ears or if it's greater in one ear. that's a normal finding to hear it in both ears equally. The Rhine test tests for air conduction versus bone conduction. So I'm gonna tap this tuning fork and place it behind your ear on the bone, and then you're gonna tell me when you can no longer hear it, okay? And then move it in front of the ear. Okay, so air conduction was greater than bone conduction, which is a normal finding for that test. The third test is the whisper test, so I'm going to include one of Erin's ears, and I'm going to ask her to repeat after me.
1, 2, 3, 4, 5, 6.
Okay, so she was able to correctly tell me what I said, so that cranial nerve is intact. For cranial nerves 9 and 10, I'm going to be looking at the uvula and testing the gag reflex. So you want to open your mouth and say, So her uvula is midline. And then, now I'm going to test the gag reflex. Okay. So her gag reflex is intact. For cranial nerve 11, that's the spinal accessory nerve. I'm going to ask you to shrug your shoulders and try to not let me push down. Okay, and then we're also going to look at turning your neck to the right, and I want you to push against my hand trunk. So that nerve is intact, and then the last nerve, cranial nerve 12, is the hypoglossal nerve, and that we're just going to let your tongue stick out your tongue. You're going to look at the symmetry of the tongue. I want you to move it up and down, left to right, so she's got full movement of the tongue, which means that that cranial nerve is intact. So now I'm going to move on to the neck. You want to inspect, make sure that the neck is supple, that the trachea is midline. You can also palpate the trachea just to make sure it is midline, feeling for any masses, any swelling, any deformities, looking for any lesions or rashes. And then I'm going to go behind Erin. I'm going to have her take a sip of the water. Not yet. And when you take a sip, I'm going to feel for the thyroid. So I can definitely feel the thyroid gland. It is not enlarged, and there aren't any extra lobes. So now I'm going to look at the posterior thorax. So you want to first inspect, look for any acute distress. You want to look at the skin to see if there's any lesions, any moles. Also look at how she's breathing, look how she breathes in, breathes out, and she's in no acute distress. So now you can palpate and feel for any deformities, any swelling. Ask her if she's feeling any tenderness. Okay? So with your hands like this, you want to start at the beginning, at the top of the back. And this is tactile firmness. So you're looking for any increased vibrations. So as I move down the back, Erin's going to say 99. Go ahead.
99, 99, 99, 99.
There wasn't any increased vibrations, which is a normal finding. So now I'm going to also look at her chest expansion. So around the 10th rib, you want to place your hands around her rib cage at the 10th rib and ask her to take a deep breath in and out, and just look at if it's symmetric, and it is. So she does have symmetric chest expansion. So now I'm going to percuss. So you can sit back around. I'm going to go on this side. So I'm going to start at the top and work in the zigzag motion going down. And you want to make sure you hit all the lobes. And then when you get down here, you can also, you're checking for CVA tenderness. Is it tender? That would look for any type of kidney issues, but Erin says there's no tenderness. So you want to make sure that you're hearing the resonance. So for percussion, there wasn't any hyperresonance or any dullness, which could indicate some consolidation, possibly pneumonia, but Erin does not have any of that. So now I'm going to take a listen in all each of the lobes. Again, starting at the top. Okay. So her lung sounds were bilaterally equal and clear. She doesn't have any wheezing or crackles. There's no adventition cells heard. So now we're going to go back and do the anterior adjustment. Alright. So again, you want to start out with inspection. Look at the skin. And normally you would be listening on your stethoscope on the actual skin, but for the purposes of this video, I'm going to stay on top of her clothes. So look and see how she's breathing. She's in no acute distress. Look for any lesions. Palpate for any deformities or tenderness. Is there any tenderness? And you can actually go ahead and incorporate the cardiovascular assessment in by palpating for any heaves or thrills. So at each cardiac point, aortic, pulmonic, Erb's point, mitral, tricuspid, excuse me, and then mitral. So she doesn't have any heaves or thrills, but I was able to palpate her PMI at the apex of the heart. So that is a normal finding. So now we're going to do the tactile pharmacist again, looking for any increased vibration. So 99.
99. 99. 99.
Okay, and so there's no increased vibration there. You want to do percussion. And so hers was resonant. There's no hyperresonance or any dullness heard, which is a normal finding. So now I'm going to listen to the long sounds first. So her lung sounds are bilaterally clear and equal. There are no wheezing, no adventition sounds present. And now I'm going to listen for her heart sounds. So I'm going to use the diaphragm first, listening for S1 and S2, any extra sounds, and then I'm going to use my bell to see if there are any bruises. So you can breathe normal. Aortic, pulmonic, Erb's, tricuspid, and mitral. So I was able to hear S1 and S2. There are no extra heart sounds. And then I would also repeat that with the bell to hear for any bruise. Okay, now I'm going to let Erin lean back. I want you to turn my way, your neck. And so now you want to assess the jugular vein, and it is normal at this angle for there to be some protrusion. So that is a normal finding. You all can also take the time now to palpate the temporal artery and the carotid. Make sure you don't palpate both carotids at the same time, but the temporal and the carotid arteries were 2+. And then you can also listen here for any bruises. She does not have any bruises. So now we're going to work, and I'm going to assess her abdomen. On the side. So first you want to inspect the abdomen, look at the curvature, the contour, the umbilicus to see if there's any striae, any pulsations, to see if there's any hernias. but Aaron does not have any hernias or any striae. It's pretty flat. And then you want to listen. So you always want to listen before you touch the stomach. So you don't want to manipulate any abdominal sounds that might not be there. She does have bowel sounds in all 4 quadrants. You can hear some gurgling. So now you want to also listen in the epigastric area for the aortic artery, the bilaterally, the renal arteries, and also the iliac arteries, just to assess to see if there are any bruits there. You would also assess the femoral artery, but because we're keeping our clothes on, we're going to skip over that part, but you also want to definitely assess the femoral artery as well. So now we can percuss. You want to listen for tympani, which is the normal bowel percussion sound. And then we're also going to percuss the liver and measure the length of the liver. And a normal length is for adults is 6 to 12 centimeters. So you want to start with the midpoint line. And Aaron's is 7.5. So hers is within a normal range. So now you want to lightly palpate the abdomen, looking for any masses, any areas of fluid, any tenderness, okay. And then you want to move on to deep palpation. So on your right side, you'll try to palpate the liver. So you want to cuff your hand, take a deep breath. So I wasn't able to feel the liver, which is normal. It's not usually palpable. We're going to do the same for the spleen. That is also not palpable. And then you want to check for the kidneys bilaterally. So I'll check it on this left side. But hers are non-palpable, which is the normal finding. So now I'm going to do the musculoskeletal system, and I'm going to start at the top and work my way down, but I'm also going to incorporate checking the like the muscle strength and the pulses. So you want to first always inspect and do it on both sides to look for symmetry. So we're going to inspect the shoulder, see if there's any crepiness or tenderness. No, on palpation. Okay, so then we're going to check the range of motion. And she's got full range of motion. So then we're going to work our way down, just looking at the muscle tone, which is appropriate. Working our way down to the elbow, inspecting the elbow. Keep in mind you're also assessing the skin just for any lesions, rashes, moles, anything like that. Any tenderness on your elbow? No. Okay, so we're going to check her range of motion. And she's got full range of motion with her elbow. So working our way down, we're going to palpate the radial pulse. And hers is 2+. Looking for any deformities of the hands, any swelling of the extremities. You also want to feel the temperature, but hers is warm and dry. Any tenderness in your hand. Okay, so I want you to bend them down, bend them up, side to side. Okay, she's got full range of motion. So try not to, I want you to push your fingers out. Okay, so that is all intact. And you also want to check the capillary refill. Hers is less than 1 second, which is a normal finding. There's no clubbing of the nails, and they are well manicured. Also, we're gonna test the muscle strength. So squeeze my hand as tight as you can. We're gonna do both. Okay. So muscle strength is 5 out of 5, which is a normal finding. Now we're gonna move on to the lower extremities, starting with the hip. See if there's any tenderness with the hip muscle, hip bone. And there's not, you want to keep looking at the skin, inspecting the muscle tone is appropriate. She looks like she's got workout body muscles, like she's hitting the gym. Just feel, especially in your lower extremities, you want to see if the patient is retaining fluid, if their ankles are swollen, and then if they are swollen, if they are, you want to make sure you grade that on the correct scale. If it's pitting, if it's weeping, but she doesn't have any edema. So now we're going to move down to the knee. We're going to palpate and inspect the knee. There's no crepitus. Is there any tenderness? No. And you can also palpate the popliteal. For the popliteal pulse and hers is 2+. Making our way down the leg, looking at the ankle and the feet. Is there any tenderness or any pain? I want you to bend your knee, move your knee out. Okay, and then put it back down, and then lift your foot up and back down. Okay, and then so I'll assess the posterior tibial pulse, and then also the pedal pulse, which you would normally want to do underneath the sock, and they are both 2+ bilaterally. So I want to test your strength. So push down, and I'm gonna push up. Okay, so that is 5 out of 5, and that is a normal finding. I'm gonna have you stand up on this side, and we're gonna look at the range of motion for the spine. So I want you to bend over, and stand back up, and bend backwards, and then side to side. Okay, so she's got full range of motion, and I also want to palpate down the spine, just checking for any tenderness or abnormalities. Do you feel any tenderness when I go down the spine? Okay, so I'm going to test some motor function. I want you just to walk back and forth like you normally would. Okay, so this is looking at her gait. You can stop looking at the gait, make sure it's steady, which she is steady, looking at how she's walking, and she's got symmetric steps. So I want you to do heel to toe. This looks at the motor function, okay? And then, that's good. And I want you to stand with your feet together, your hands on your sides, and close your eyes. So this is the Romberg test, and Erin has a negative Romberg test, which is a normal finding. Had she had a positive finding, she would have been swaying, she would have lost her balance. But she was able to stand still. So now I want you to sit back down, and I want with your finger touch your nose to my finger. Okay, so that's intact, and then I want you to take this heel and run it down your shin. Okay, so she was able to successfully do that, and this is all testing motor function. And so now we're going to do the reflexes. You can say just like that. So I'm going to do the triceps. Okay, so that's intact. Now we're going to do the bicep. Okay, and then the brachioradialis. Okay, so that those reflexes were 2+. Then we're going to do move down to the patellar. Okay, that was intact. And then you also want to do the Achilles. And then check for the Babinski reflex. So you're going to stroke the bottom of the foot. And her toe did not dorsiflex. So that is a normal finding. You don't want the toe to dorsiflex. So she's got a negative Babinski.